You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. With us, we have Dr. Taher Dhoon. Dr. Dhoon, welcome to the program.
Hey, I appreciate the invitation.
Sure. Now, I know you brought some photos, so we'll get to as many of those as we can. Now, for people that don't know your practice, like, who's your typical implant patient?
Well, we have two major types of implant patients. We have the people who are on their way to dentures, and they've just been dealing with problem after problem, bad breath, ailing teeth, painful teeth, infection, you name it. They've gone through the hardest part of dentistry many times over throughout the years. And then we have, a whole subset of the population who are actually missing all their teeth currently. I mean, Randy, there's 30 million Americans who are missing at least one full arch of teeth. And wow. If we just go to northern Colorado, we could fill up Coors Field, the Pepsi Center, Mile High Stadium, all the local bars, and all the tailgating spots, and have a line around the corner okay. with everyone who could benefit from these services.
Now, so is it true, because we talked on the phone, that on the day of the procedure, obviously everything has to work out, but it's very common that they walk in with no teeth on the day of the procedure, and then they walk out with teeth that don't come out? Upper and lower sets of teeth.
Absolutely true. I actually took care of that for a lovely patient named Charlotte on Friday, right before coming out here.
What happened?
So actually, Charlotte came in. She already had an upper denture. She had a lower snap-in, snap-out denture, and it just wasn't cutting it for her. She'd been in that for about 30 years. She loved blueberries, loved raspberries, would always get the little seeds stuck underneath her upper denture. And the most embarrassing part for her was she'd have to go to the bathroom, and she'd have to take out the denture, hope nobody walked into the bathroom while she's cleaning it out,
wow.
Wash it out. Sometimes she'd even do it at the stall if the restaurant was very busy. And A, that's not very sanitary. B, it's hard to keep that clean just in general, and then pop it back in and get out to dinner. So she was tired of that happening. She'd been dealing with it for decades. She had adapted to her situation, but it just was time. And she wanted something that just never came out. She wanted to brush it in her mouth like they were her own teeth. And so she came in and she left that very afternoon with a brand new set of full upper teeth and lower teeth.
Is that right? And how soon can they eat after when they get their new teeth?
Right away. Softer foods at first. I tell them, they're brand new. Don't go run a marathon on them. You're going to walk, you're going to jog, you're going to, walk or run and then sprint. But after a little bit of healing, you can pretty much eat anything on them. You can bite through a juicy steak. You can eat, carrots and apples and anything you really want to eat. You can eat peanut brittle on these things once you get your permanent set.
Do you hear eating stories all the time?
Every single day. Most people come in and first they just light up because their confidence, the amount of charisma they bring to the table when they have their new set of teeth, it just blows me away every single time I see them for the first time. And then we always talk about one eating story. There's someone in here named Reuben. I'm going to show you his before and after transformation. His story really, pulled at my heart because he loves eating apples. And when let's
take a look. Is it that? Yeah, let's start with him.
Yeah, let me show you Reuben here.
Okay.
He absolutely loves eating apples. And with his current state, he couldn't bite through an apple. He'd have to ask his wife to bite the apple and hand him the piece just so he could eat the apple. Really. Who
tells you this? He does, or the wife does?
No.
They both come in on the consult?
No, the patients will typically tell us. They're not going to tell you, they're not going to tell their friends because it's a little embarrassing.
All right.
But when they come in to see me, these are the stories we hear on a daily basis, and it's just hard. It's hard to go through this. We'll never understand what someone with dentures or who's on their way to dentures has to deal with on a daily basis. So Reuben actually came in after being referred to me by another dentist in Greeley. And he had actually seen two other dentists before that dentist had referred him to see me. And all three of them have told him that he did not have enough bone to get dental implants placed. That the only thing he could have was an upper denture and a lower denture, and there were no other options. And Reubens Story is phenomenal because he's an ex-Marine, he's a vet, his son is graduating from the Air Force, and he wanted teeth, a fixed full arch of teeth, to surprise his son at his graduation because his son has only known him with bad teeth his whole life. So Reuben comes in, he just looks me dead in the eyes. He says, I'm not going to wear an upper denture to my son's graduation. I need another option. What do you got for me? And because he'd been referred by 3 other dentists, I was almost a little concerned that he may not have enough bone, but we get the 3D scan, I get to look at everything. I looked him dead in the eyes and I told him, you have enough bone, we'll get you on the books in 2 weeks. So Reuben comes in the day of the procedure, and he's nervous, he's excited, he's just a little bit of everything. The movie Armageddon, there's a scene with Owen Wilson where he says, I'm 99% excited and 1% scared, or it could be the other way. I could be 99% scared, 1% excited. That's what Reuben was every 5 minutes. And so we had him kind of just doze off, pretty much asleep. And
you give him sedation, right?
Yeah, okay. We do the sedation in office. We do everything in office, so you don't have to go to 3 different offices to get this procedure done. All you do is you come see me. We take care of everything all in one morning. And Reuben woke up. We handed him the mirror, and you guys will be able to see that transformation.
You have a video.
We brought the video of him looking at his teeth for the very first time.
This looks really good.
Yeah, he was over the moon, and that picture is just a picture of his temporaries. His permanents are going to look better than that. That is what you get within 4 hours.
So when this is all done, what do they say?
Sometimes they're speechless. Sometimes there's just this moment of disbelief. Sometimes they just light up and they have to relearn how to smile, and you can see that, they're not used to tensing their lip in a certain way. Usually we hear a wow. 1 or 2 wows, 1 or 2 of those that's better than I thought it was going to be, or that looks better than I ever expected. Something to that nature. That's what we hear on a daily basis.
It changed his appearance. There's no doubt about it.
Yeah, he looks 15 years younger. What people don't understand sometimes is when you lose your teeth, the teeth hold your facial dimensions open. Okay. Keep your nose and your chin further apart. As you start to lose the teeth, the nose and chin get closer together, the cheeks sink in. By giving someone a new set of teeth, we're actually giving them a facelift.
Well. Okay.
Yeah. We're improving their ability to eat. We're improving their cosmetics. We're improving their self-confidence. We're doing all of this in just one morning.
What does he like the most? How he looks, or what he can eat?
His confidence right off the bat. First he was talking about apples. We mentioned that his ex-wife would have to bite the apple for him. That's no longer a problem for him. But really, it's this sense of self-confidence. He actually went to work the very next day. He came in, he told me his boss was like, "What are you doing here, Reuben? Get out of here. You just went through this procedure." And he just wanted to go to work so everyone could see his brand new smile before the weekend rolled around.
So the downtime can be very minimal.
Very minimal. I saw him a week later. That's when we took that picture. No bruising, no soreness, no pain medication. He was eating the foods he wanted to eat. Soft foods, but he was pasta, fish, pulled pork, pulled chicken, all that stuff. He was eating all of those things, and he was just over the moon.
Okay, so if you said at the top of the show that there's tens of thousands of people in Colorado with an upper or lower denture. So if implants are so good, why aren't they all doing it? What's your take?
Yeah, there's a lot of reasons why people, think that they don't want to do implants. For our denture wearers, they're just out of the system. They've been through all the painful parts of dentistry their whole life. Failed root canals, bad breath, painful dental procedures. My guy growing up, he was old school Navy. I was 9 years old. There was a filling, I started feeling it, and I said, hey, I kind of feel it. He's like, no, you don't, and he kept going. That day is seared into my memory, and that was one filling, and maybe it was 5 minutes of true discomfort. I can only imagine what these patients go through when they have to lose teeth, when they have to have infection, when they have to take time off work, when they have to go through all of these bad things for decades sometimes.
Then they end up in a denture.
Then they're in a denture. They don't have the teeth anymore.
So they don't want to come back in. It's hard to get them in.
I don't blame them. They don't want to come back. They're out of the system. They don't think they need to do anything else. So frankly, they don't get to hear about all the technology, all the advances that we've made to make these transformations happen. And then for the other patients, they think they're too old sometimes,
How old can you be to do this?
Age does not discriminate against implants. In traditional medicine and surgeries, as you get older, typically more complications occur. With dental implants and the jawbone, it doesn't matter. Okay. You can place a dental implant in someone who's 86, who's 92.
Why would a 90-year-old want to do this?
Yeah, well, I'm glad you asked that. I did a consultation last Tuesday, and a patient's daughter asked her the exact same thing. So we're in the consultation room, we're reviewing the options, and the daughter looked at her mom and said, "Hey, Mom, you're 86. Is this all really worth it?" And she answered this question better than I can, so I'll just tell you what she said. She looked at her daughter and she said, "Look, we all get older, but I don't want to feel old. I want to eat all the foods I want to eat until my last day." I mean, and
Nice.
that kind of gave me chills because it summed up everything that these patients go through in just 2 sentences.
So denture wearers can't eat and chew very well.
No, I mean, there's
right?
studies that show that when you have dentures, the forces that you can exert with your jaw muscles decreases to sometimes down to 6%. Imagine trying to eat at 6% of your natural functioning. It's just not possible. A lot of people, especially the healthy foods, they just mush it up into a ball and swallow it. And so when you do that and you're not digesting foods properly, I mean, I could do a whole segment about just the GI and the foods that we can't eat and how that affects us on a negative basis.
Yeah, but what about the people that have bad gums, like gum disease, bleeding gums, bad breath, loose teeth? Are their gums too bad to do this?
Not at all. Those are actually the people who need it the most. The bad gums and the bleeding and the bad breath, all of that comes from the infection from the teeth. If we get the teeth out of there, the body's very resilient. The human is very adaptive. We can get those teeth out and the gums will heal up, the bad breath is gone, the infection is gone, and then we put dental implants in and we're restoring them back to their full functioning without all of that infection.
So, as a dentist, you probably think the smile is like the most important thing. How important is the smile in your opinion?
I mean, I hands down do think the smile is a very important thing, but I mean, don't take it from me. There's studies that were done, thousands of Americans, and when you look at any magazine, you look at any study, whenever they say rate the most important part of a person, the smile always makes it in the top 3.
Yeah, that's a good
always
point.
the top 3, because 95% of our body is covered with clothes, but what's front and center? It's that smile. You know, how, if you go to another country, how do you know if you don't speak the language? How do you communicate? You communicate with your eyes and your smile. I mean, people want to know that you're friendly. So when you smile and you brighten up, I mean, that actually opens up a lot of doors for you.
Now, I mean, do these people, what do they like the most? Do they like their new smile, the compliments they get, or do they like the chewing?
Yeah, well, I mean, once we watch Reubens' video, you're going to see his 1-week video. He told me that he was afraid to smile. He was afraid to go out in public places. He was afraid to
Really?
laugh fully. He would have to cover his mouth. He'd have to stick his tongue into certain areas. He would have to do something to cover up the spaces so that he could actually laugh. And then when he actually did have a natural laugh, he was almost embarrassed afterwards. And so when you give them back this smile, you're not only just improving their function, you're giving them back a sense of self-confidence. You're giving them back like the simple things in life that we like to do with the people we care about.
You said you see them come back like for follow-up appointments. They're like not even the same person.
I hear laughing. I hear laughing in the reception area. I mean, they're joking with my team. I know Reubens walked through the door before I even see him because he's so happy and everyone's so happy to see him. I mean, he's part of the family.
Let's go to that video. You gave us the video. We're going to go to that clip right now.
Absolutely.
And this is Reuben.
Correct.
Okay.
Always had a fear of dentists. So and I've always put other people ahead of me. Expectation wise, I'll be honest, I'm extremely nervous.
Take a peek.
Better than I expected. My whole jokes are about the gap in my teeth and this and that. And I gotta write all new material. You know, even though the idea of the cost may frighten people, it was ideal to take care of yourself. I mean, like I said, I'm learning how to smile all over again. When I walk around, I notice that I'm not afraid to smile, which was my biggest fear, was, you know, the reaction of somebody's face, the look on their face when I did smile. Now I can't wait to see their reaction when I smile. You know, I've been given compliment after compliment about how natural it looks and how good it looks, and to me, it's worth every cent that I'm going to be putting into this, you know, because I know that it's going to be something that I get to enjoy the rest of my life.
Very nice.
Yeah, we see that every single week.
Now, we need to mention that even the best dental insurance doesn't cover dental implants, only a small portion. and Medicare, Medicaid doesn't cover it.
Well, actually nowadays, I mean, we can maximize the dental benefits that the patient has, and we'll do that. We have a specialized team that maximizes those benefits for them. But like any investment, people are financing this thing.
Are they really?
Absolutely, absolutely. People are breaking this out over 5 to 10 years sometimes, because that's the investment that they want to make.
So you don't carry it yourself, the financing. You have outside lenders that do the financing?
Correct.
So
Yeah,
you have to have decent credit.
Sometimes the credit has to be decent, but sometimes we can work within a budget, and we can work with people to get them the treatment that they need. It's such a common procedure these days that we have so many different companies that have come on board to help out these patients.
Okay, good. You have more photos. What are we looking at?
All right, so Jim here, he actually started with us with a snap-in, snap-out denture.
Okay.
And he wanted to keep those front 6 teeth. And within a couple of months,
Like snap in, snap out lower denture?
Upper denture.
Upper denture.
Snap
okay.
in, snap out, upper denture. And within 3 months, he gave me a call. He was like, you know what? This is great, but I don't want them to come out anymore. And so all we did is we added a couple more implants, and this is the transformation that we were able to create for him. So right off the bat, you can see that his nose and chin are a little bit further apart.
Yeah.
His face looks skinnier, and all that's because his bite has collapsed. So we opened up his bite, we gave him a full arch of upper teeth, and it changed his face. He's out there dating. I mean, he was over the moon. I mean, he would light up every time I would see him. He'd shake my hand, he'd thank me multiple times. I mean, I just love seeing Jim in the practice because, it's just, we've made such a big impact into his life.
So no more dentures?
No more dentures.
You think those will be a thing of the past? Like in 20 years, possibly? Like dentures as we know them today are gone? Everything's attached to something?
Yeah, I think just like we drive a car to work now, having dentures is going to be like riding a horse to work. I mean, you can still do it if you want to, but really, I mean, the path of least resistance is to hop in the car and get to where you got to go. All right. So Michelle over here.
Oh my goodness. This has got to be unusual, right?
Not at all. So patients like this, you just don't get to see them because they're always tensing their lip over their teeth. They're always hiding their smile. You may actually confuse them as someone who's just unhappy or who's grumpy all the time, but in reality, they're just covering their
hiding their teeth. So she comes in like this, and what's going on, and what were her options, and what did you do?
She really had no options. I mean, the other dentists had made her feel so bad for years that she actually disappeared. She was out of the system for years. And when she came back in, just because of what someone else said to her, it embarrassed her to the point where she did not want to come back to the dentist. And so hearing that breaks my heart because this probably could have been salvaged and fixed in a much more efficient way years ago. And that's what I want patients to know is like, come see me right away if you're thinking about this, because the sooner we do it, the more successful we can get the outcome to be. So we were able to give her a beautiful set of upper teeth and a snap in, snap out denture on the bottom.
Okay.
And on top of that, we set her up for success in the future where we can add to that and transition her over into a fixed full set of upper teeth in the future when she's ready for it.
So you could make somebody a cosmetic like upper denture and then give them a brand new set of teeth on the lower. A little bit less expensive option.
Absolutely.
That snaps in, snaps out.
Absolutely. And Michelle, I mean, if you look at her before and after, she was absolutely thrilled. And my goal for Michelle is eventually to give her a fixed set of upper teeth that lock in, that never come out. I mean, kind of like your dad, Randy.
Yeah. We mentioned, my father was wearing a denture for 20 years, and he started with a snap-in, snap-out set of teeth. And then a year into it, because there's some maintenance with those snap-in, snap-out, he now has a fixed set of teeth. And he's now, I told you, he's 84 years old. He's obnoxious. He smiles nonstop. He's like returned to the way he used to be. And he thinks young girls like him, and he's a musician. Do you see that kind of a thing? I mean, a guy gets their teeth back and they're like a brand new person.
Always, always. I mean, confidence is one of those things that can change a person. They'll come in, their hair is different, their beard is trimmed, their clothes are different. It brightens up their day. It brightens up the day of the people around them. It makes their loved ones happier to see someone they care about happier. I mean, it's like the first dominoes hit by this transformation, and everything that unfolds after that it's life-changing.
And like back to this woman right here. I mean, look at what a big difference. So before she just kind of never showed her teeth.
Yeah.
Kind of smiled with her mouth closed.
If she tried to. Yeah.
And now
she's ear to ear. She's over the moon. I mean, she's just so happy. She comes back. She's excited to see the dentist. Most people in Michelle's scenario before, I mean, it's hard enough to just get them to pick up the phone and give us a call.
Because nobody likes going to the dentist.
hey, if I'm in the chair, I don't like being there either.
Do they ever say that to you, like, no offense, doctor? But
Always. And what we find is it's just anxiety. It's anxiety from past experiences that make them hate the dentist, but we have a solution to that. And we have a way to make the dentistry get done in a way that, they don't have to remember the whole appointment. They can come in, they can kind of gently doze off. We wake them up when we're done, and most people remember me walking in the room, and then they remember waking up at home. And they have a brand new smile.
During the procedure, they don't feel anything, obviously.
No, not at all.
And then, it's different for everybody. But the downtime, are they taking pain medications, or what are you doing?
Some people are sore for a couple of days. I'm not going to sugarcoat it for you. I mean, some people are sore for a couple of days. But Reubens, the first case we saw, he went to work the very next day. He didn't take any pain medication. He was just taking Tylenol. I mean, Michelle probably was sore for a couple of days. But this stuff is the technology and the skills and everything we have at our disposal has made this so much easier for patients to get the care they need, that it's not like the old days where you have those horror stories, where you have those people are swollen out like chipmunks. Like, that doesn't exist anymore.
And the prices have come down.
Absolutely. I mean, with the increasing technology and the ability for us to do all of this in-house, the prices have come down significantly.
So no more dentures?
No more dentures.
Do you think you can wipe them out in Colorado?
I'm going to need a little bit of help.
Is that too big of a goal? But
yeah, absolutely. If I can train enough docs with me, we can absolutely eradicate this. Let me walk you through the day of someone who wears dentures.
Okay.
They wake up and they take their teeth out of a glass jar or a cup of water. I mean, first off, that's a problem. Nobody in today's day should be doing that. Then they have to go in the bathroom. They have to add a tablespoon of adhesive to their dentures. When you seep that in there, it's like molasses flowing over your gums. Then they eat something soft for breakfast, scrambled eggs or oatmeal sometimes, because they don't want to dislodge the glue that they've just put in their mouth.
Okay.
Then they go off to work. And they typically, and one thing about these cases, they all tell me one thing, is they don't want to spend time with their colleagues in a lunch setting because they're afraid of what might happen when their teeth come out. I had a patient years ago, her name was Kim. She had a lower denture and an upper partial. She was at her husband's work dinner, eating soup because she didn't want anything to happen, started laughing hysterically at some joke, and her lower denture fell out onto the table. She said that moment was the most embarrassing moment of her whole life. And the very next week, we were placing some implants to have a snap-in, snap-out denture for her. So, they avoid lunches with colleagues because they avoid going to their friend's house because they don't know what their friends are going to serve for food. And so if their friends serve something that's too hard or that could potentially dislodge the denture, then they have pre-rehearsed excuses of, oh yeah, I already ate, or oh yeah, I have to go do this. And they have these preset routines because they know what could potentially happen and the embarrassment that could occur.
Would you say this, that look, there's a lot of denture wearers or people headed to dentures. If they knew how good this was, do you think they all would come in? Because there's not enough dentists to service the people. Like if there's 30 million people with an upper lower denture, there's only like 195,000 dentists.
Yeah.
Can't handle the business.
We would all, if all the dentists in Northern Colorado could do this procedure, we would still all be busy for years. We'd all be busy for years. And I think that if patients knew what was available to them, knew that it wouldn't hurt, knew all that the old misconceptions about what dental implants are, and if they hurt, or if you're too old for it, or if the bad gums can exclude you from being a good candidate, all of those things we have solved with technology. We have solved with the new skills we have available to us. So the hope is that we can get this education out in front of the patients in North Colorado and we can change their lives.
We are short on time. So somebody watching this, they fall into those two groups. They're headed to dentures, really bad teeth, or they're currently wearing dentures.
Yep.
When they go to your office, what are their options when it comes to dental implants?
Yeah, so we can start off with 2 implants on the bottom. Basically take that adhesive and throw it away.
Like just 2 implants?
Just 2 implants right here on the bottom. The denture will snap in, it'll snap out, no more adhesive. Significant improvement in life. However, with 2 implants, there's still a little bit of rock in it, right? Then you can place 4 implants, have a snap in, snap out. I equate that to sitting in a 4-legged chair versus a 2-legged chair.
Okay.
Right? The 4-legged chair, you're gonna be way more stable. Then we can do the fixed upper arch of teeth, fixed lower arch of teeth.
That just means teeth that don't come out.
Brush them in your mouth like they're your own.
Is that right?
Yep, eat whatever you want to eat. The materials we have nowadays, I mean, before we were making this stuff with plastic teeth. Now we have a material called zirconia. We have the 10-year studies on this stuff. strongest material we've ever seen in dentistry. I mean, the only other material that's comparable is gold. And we're not giving someone a full arch gold.
Okay.
So if you wanted something that looks like natural teeth, that is strong and durable like metal, this stuff is amazing. You can eat anything you want to eat on it.
And it doesn't matter if you're 80 or 90 years old.
Nothing.
Yeah, but what if you're on like a few medications? I mean, if you're 75 plus, I mean, people are on medications.
Yep. Not a problem at all. The only people who truly have a higher risk of failure for this are people who've gone through head and neck radiation treatment. Head and neck radiation treatment is something that it's a curveball, and we approach the case a little differently, and we talk to the physicians, we talk to the oncologists, and we make sure we can approach this in a safe way. But other than that, there are so many options available to people these days that cholesterol medications, blood pressure medications, diabetes, all these things, they don't keep you out from getting dental implants.
What about a little bit of osteoporosis? You're in your 70s, a little bit of osteoporosis?
Osteoporosis in the whole body doesn't affect the jawbone and does not affect the way the implants will integrate within the jaw.
So you can do this on just about anybody that wants to do it, and you have financing available.
Yep.
Final message, somebody watching this, and for whatever reason, they've heard what you had to say. They're still afraid. Maybe they're wearing a denture, or maybe they have really bad teeth. They're worried about finances. What do you say to them?
I just say come in for a free consultation. I mean, come in, meet my team, talk with me, get the free 3D scan. We put it up on the screen. We go through everything together. I give you all your options. And then after that, I'll guide you through this. Some people, they just want the facts. They just want to get it done. They've been thinking about it for years, and they're ready, and they're just looking for the right home to do this. Other people, they just don't know what's available. And I could talk dentistry forever. I'll educate you about the ins and outs of everything, what your options are, and we'll find a way to get you to where you want to be.
So what is their number one concern? Somebody coming in with no teeth, like what do they want to know? Like what's the question they give you every time?
Can this be something that I can do? And the answer is 99.9% of the time, absolutely yes.
Do you ever get excited, like you're in a consult, and you're hearing a little bit of their sad story, but you're going, boy, this is going to be good?
Yeah, every single time. This is the type of dentistry that wakes me up in the morning. This is the stuff, I wake up before my alarm goes off because I'm so excited to do this. Because if we do one filling or one crown, I mean, that person's not going to know that we did anything phenomenal in that respect. They just don't want to know it's there. But when we do these smile makeovers and we do these reconstructions, I mean, every time that person wakes up in the morning, they're seeing the work we've done. We're improving their health. We're improving their self-confidence. We're doing all of that in one morning.
And the maintenance is like every 6 months they go in just like they have their own teeth.
Yeah.
Is that right?
Brush them in your mouth, use a water pick, come see me twice a year, and we'll treat you just like one of our regular patients.
Is that right? And people wait, like you say, on all these photos you showed me, a lot of these people, like years and years and years of hating their teeth.
Yeah, I ask them all the time, how long have you been thinking about this? And it's never 1 week. It's years, decades.
So they missed out on a lot of good years.
They missed out on a lot of good years, and the good news is that they have a lot of good years ahead of them, and they're going to enjoy it for that many more years.
Okay, good. No more dentures, and you do it all right there under one roof.
All in one place.
Okay, good. And it's a free consultation.
Absolutely.
All right, good. I want to thank you for coming on the show. Good stuff.
I appreciate you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.